In our recent study, we were focused on effects of renal denervation on left ventricular function in hypertensive rats with volume overloaded heart failure induced by aortocaval fistula. Renal denervation is a method used for treatment of hypertension in patients with hypertension, and it's known for its antihypertensive effects. However, the effects of renal denervation on heart failure are currently poorly known, and therefore we wanted to investigate them further. We had in this study hypertensive rats, and in first week we performed aortocaval fistula, which is volume overloaded model of heart failure, and in second week we performed renal denervation. So we destroyed sympathetic nerves around renal arteries, and after 2 weeks we monitored the rats with echocardiography and pressure volume analysis. We found that ACF rats had decreased systolic function of left ventricle, and also they had hypertrophy of left ventricle, and renal denervation significantly decreased hypertrophy and congestion of lungs, and also renal denervation improved systolic function of left ventricle in heart failure rats. Those changes were followed by changes in sympathetic nervous system. We found that ACF rats with heart failure with aortocaval fistula had significantly decreased norepinephrine levels in cardiomyocytes of left ventricle, and renal denervation significantly normalized and increased norepinephrine levels in left ventricle. This study was published in journal Hypertension Research.